Hello, everyone, and welcome to a new episode in our program In Sync. As usual, we discuss many of interesting topics that has many debates and questions around them, and we bring you all the correct information and the right information that you need to know. Before I proceed and introduce today's topic, I would like to welcome my colleague and my friend, Dr. Mariam Aldashti. Hi, Mariam.
Hi, Sundus. How's your day?
It was good, actually. I had one case, and that's why I thought we should discuss it in today's episode. It's really an interesting topic, and it has many debates around it, many questions around the previous years regarding whether to know the cause, whether to vaccinate or not, whether there are genetic factors or not. So I think without further ado, we should introduce our topic.
Absolutely. So today we're going to talk about a controversial topic, let's say. Unfortunately, we are seeing cases on the rise, and it's worldwide. And I think part of it is awareness. This is why there's more cases being diagnosed. And what our topic is today is autism, or autism spectrum. And obviously, autism is mostly a psychological and physical condition. It's a neurodevelopmental condition. Now, there isn't a definite cause, but obviously there are factors which are considered a causative factor, genetics, environmental, which we will discuss further on. But autism is, like we said, it's on the rise, and we are seeing it in extremely, obviously, the symptoms in extremely young ages. I mean, I think we've all seen those videos where a 6-month-old has some traits which are autistic traits. And it's a condition, though, albeit has spectrum, which means levels. So it could be at a lower level or a higher level in terms of deficiency. But at the same time, nowadays, because there's more awareness, even amongst the medical field and research, so treatment has evolved, and addressing and making a patient or an individual and their loved ones, when it comes to their dealing with this condition, is more feasible and easier.
Definitely, Miriam. And you said that autism is a spectrum. And you know, it has been changed, the name, over the past few years. Before, there were many names underlying the autism, which is Asperger syndrome and the other ones. Asperger is considered the mildest form of autism, but now they are called, all of them, autistic spectrum disorders. There is no more Asperger, no more other names. And you mentioned the valid point that we have seen a video regarding a baby, 6 months old, diagnosed.
Yeah.
And you know that there is neonatal signs of autism. Like when you call the baby's name and the baby does not look for you, or doesn't maintain eye contact, does not coo, does not develop as normally as any baby, then there are the alarming or red signs that the baby should be examined for autistic spectrum disorder and other diseases. And you know that autism is related to other neurodevelopmental disorders. 30% of them, they have ADHD. Or attention deficit hyperactivity disorder. Many of them will have depression and anxiety disorder. Many of them will have
epilepsy.
Yes, and 30% actually of autistic people who have epilepsy. And you mentioned that it is associated with many genetic factors. Even though there is no definitive gene that tell us that this baby is going to have autism or is having autism, but there are some other diseases or syndromes associated with autism, like Fragile X syndrome, Rett syndrome, Fragile X, where there is developmental delay. There are many other symptoms, but one of them, they are more prone to have autism. And Rett syndrome is a disease that only happens in girls, but there will be smaller or delayed enlargement of the head. So by the time they are 1 year or 2 years, their head size is smaller compared to the normal. And they have developmental delay, and they are more prone to have autism. So there are many syndromes associated with autism. That's why genetic factor plays a major role. And if any of the family have autism, then the chance of having autism in another newborn or a child, it increases.
Absolutely. And I think now in every household, we hear that they have an autistic child or member. So unfortunately, it's becoming more prevalent when it comes to this condition. But at the same time, I think when it comes to caregiver education, this is what actually aids in the development. Now, there are multiple targeted treatments for the individual in order to at least live a relatively normal life, let's say. I mean, depending on the severity and the difficulties this individual is facing, but some of them actually go on to live normal lives, have regular jobs, have families later on. But it all depends on what type or where you are at the spectrum.
Exactly. And you know, the case that I told you I just saw, actually for Anna and her husband, usually they noticed their daughter of having, there is no eye contact. And whenever they call her, she's not answering her name. And this is usually the reason why people go and see a pediatrician or a developmental specialist to see why this baby is not answering. Regarding the signs, the symptoms, people are more aware. So usually this is alarming signs, and the people will go and seek medical advice just to rule it out. But the good thing is that there are other causes for the child for not responding, like if
a hearing problem.
Exactly, hearing problem. If there is a stubborn child, sometimes they do it on purpose, in order not to answer back their names. But also there are alarming signs that we're going to discuss further.
Absolutely.
But with Amna and her husband and her child, they notice that whenever they call her, she's not answering. Whenever they put her with other kids, she's not engaging in the play, always sitting alone, playing alone. There is no play believe, as they noticed. So they sought medical advice. I did all the investigation, all the examination, everything was normal. Referred them to a developmental specialist, and she was diagnosed to have autistic spectrum disorder.
Awesome.
I think we will go further into the signs, symptoms, how to examine after the Did You Know report. Stay tuned with us. Welcome everyone to a very interesting topic and very interesting episode. So before the break, we gave a brief hint about autism and or autistic spectrum disorder and what is it and what are the signs. But now I think we're going to go more into details regarding the types and the signs and symptoms.
Absolutely. I think it's worth mentioning, if you notice that when it comes to young children having these symptoms, usually it's a grandparent who notices. And I think this goes back to the fact that grandparents, or at their age, there wasn't any gadgets, there wasn't any these just confined social activities. Therefore, the grandparent you associate and are paying more attention to the child's development, because back then a child is playing with the family members, with toys outdoors, they're engaging more. So I think grandparents are sometimes the ones who actually inform the parents that why isn't your child looking at you or calling back when you call their name. And I've noticed this a lot when it comes to children with autistic traits. Now, there are types of autism. It's like we said, not all in one category. So the most common verbal autism and the high functioning autism. So what that means is, from the name nonverbal, they're not verbal, they are unable to communicate. And this also faces challenges when it comes to understanding the child's needs and how to convey messages and how to at least educate the child in being safe and communicating, because they're not able to verbally express how they're feeling. The other hand, the high functioning is the child is able to communicate, but they are unable to express emotions. So it feels like they are just a robotic movement where they like things done in a certain way, in a certain, let's say, sequence, but they are able to communicate. So there is a difference between those types. Now, obviously, it can be less severe, it can be more severe, but in general, they're classified as the nonverbal and high functioning.
Exactly. But Miriam, also one should put in mind, and this is usually the questions or the problems that we face in the clinic, that the child is delayed in the verbal communication. Like usually the early sign is that at 2 years of age, a child should say a two-word phrase
Absolutely.
or sentence. Sometimes if there is multiple language input, like the mother or the parents will speak Arabic and the caretaker will speak English or the native language of her, then there will be mixture of language input for the child. So the child will be lost a little bit delay. So usually when a child or a parents come with a problem that the child is not saying clear words, usually we tell them you put them in an intensive 6 months regimen or course of continuous
Sticking at least to one language.
Exactly.
It's
And if the child does not improve, then definitely this child needs more examination. As we give them around 6 months period of time. Also regarding the repetitive movement or repetitive behavior and pattern, sometimes it will be clapping. Sometimes it will be certain arrangements that when you disrupt them, they will be very angry. Also the routines, like they wake up in the morning, I need to go brush, I need to do my hair, then I'll drink a cup of milk, then I'll start dressing. If you disrupt this pattern, then the child will be just out of pace and will start to get angry, screaming. Sometimes they have this habit of hurting themselves. So knocking their head on the table, on the wall, or even by hand. This is one type of behavior that is happening whenever the pace that they are or the routine they're used to is disrupted. And also worth mentioning that the sensation is lost with them. So they don't feel, let's say, sadness or emotions. They don't feel pain. So sometimes they can burn themselves. Sometimes they can bite themselves without feeling pain. But if you disrupt their routine, it will give them emotional disturbance of anger and aggressiveness. So these are the dissociation that is happening in their brain cognitive function.
Absolutely. And when it comes to also sensation, sometimes they are hypersensitive to certain sounds and noises. So for example, if someone's just laughing, we are used to, the tone of laughter. Just simple laughter can really cause them to feel agitated, because a simple laughter might seem like a very loud horn. So you notice that they're covering their ears a lot. Other habits and traits also, even if you notice feeding habits, they tend to arrange even their foods in a certain manner. They like to stick to certain, perhaps, colors or types of food. So obviously these are not usually normal traits, and you can spot them as early as, even younger than a year or even little months old.
Exactly. And usually the type or the age of diagnosis, usually it's at the age between 1 year and 2 years, but most of the symptoms and referrals, they come after the age of 2 years. Once the baby goes to KG or goes to preschool, they will start to see that there is difference between this child and the other children. He's not engaging in play, not talking, not maintaining eye contact. So, and usually they think that sometimes children, they don't know how to express the meaning of what they want. So they will take your hand and point to it. This is not happening with autistic children. They usually don't point. They can take your hand and put it on the thing that they want without pointing. So this is one of the alarming signs. Delayed speech is different than autistic spectrum disorder.
Absolutely. So it comes as a combination of signs and symptoms. And sometimes you see also sleep disturbances with autistic trait children, where they they cannot fall asleep. And this all goes back to the biochemistry in the brain, because all these hormones and electrical signals are all disturbed when it comes to the brain activity. And we tend to see them hand in hand when it comes to sometimes sleep disturbances. As you mentioned, sometimes epilepsy, headaches, migraines. These are all associated with the autistic traits.
Definitely, Mariam. And you know, one of the triggers for them is flashing lights.
Yes.
That's why in one of the GCC countries, they put a special ambulance for such cases where there will be no siren, there will be no flashing lights inside. It's a quiet atmosphere, and they will use other alternatives for them to take a sick child from one place to the hospital if it's required.
Yes, absolutely. And like we said, though, although there are some really extensive traits, addressing them nowadays is actually becoming easier because of evolution in obviously medicine and behavioral therapy, which we're going to go into further detail. But sometimes the autistic child, when it comes to harming themselves, this obviously is alarming. So a sign and symptom, like you mentioned, of harming oneself or actually others, because sometimes they can go up to another individual and start hitting them because they cannot express and communicate. So these are things that we have to take into consideration when it comes to having an autistic individual or child in terms of safety, which is obviously a main priority.
Definitely. And you know, Mariam, I think the rate has not changed, but the awareness of the people, awareness of the parents, awareness of the physicians, and the availability of the many specialized person in that field, whether they are developmental specialists, neurologists, speech specialists, or even behavioral specialists. All of these work together in order to diagnose and manage a case with autistic spectrum disorder. We have seen many movies actually where they put a child and they show how an autistic person should act, and whether they are children or even adults. And one of the series, it's very famous one, where there was a doctor, actually a consultant, who has an acute form of autistic spectrum disorder.
Because it's not associated with brightness or smartness.
Yes.
It's just,
Actually, they're very smart.
yes, absolutely. So it's just, let's say, just to make it easier, there is the block-in signal when it comes from the brain to the rest of the body, which is usually the emotional aspect. So it tends to be, associated with certain hormones, and with addressing all of these concerns, obviously an individual can overcome and lead a successful life.
Definitely, Mariam. I think we covered most of the signs and symptoms, and we came now to the last part, which is how to manage and treat autistic person after the break. Stay tuned. Hello, everyone, and welcome to the last and most important part of our episode, which is how to manage and treat autistic spectrum disorder. Unfortunately, there is no cure for autistic spectrum disorder, but there are many modalities that we can do in order to help those people to maintain emotions, to have a future as workers, as achieving in schools, as having their degrees. We said they are very smart, but their problem is as if they are living in a bubble, isolating them from the whole of the surrounding. So sometimes they will be infatuated regarding a wheel in a car, sometimes in the movement of the hand, sometimes in the movement of the trees, but they cannot comprehend and apprehend why is it happening. They don't have this function. So the aim of the management is to make them more aware and more mingled in the society, so they don't feel deserted and they don't feel isolated.
Absolutely. Now, when it comes to treatment, I think what we mentioned when it comes to the symptoms, so the frontline usually treatment for autistic children is behavioral therapy, because behavioral therapy, you're starting to re-educate the brain onto how to communicate with the outside world, because like you mentioned, it's like they're stuck in a bubble. And there are different methods that actually is being used when it comes to behavioral therapy. and also occupational therapy. These go hand in hand. So, for example, for non-verbal autistic individuals, they tend to use pictures and images of the sequence of the things they should be doing. So, for example, when you wake up and go to the bathroom, you see images of, first of all, I brush my teeth. Second, I gargle. Then I have to wash my hands. Then, so in sequence, because they're able to follow visual commands, but their brain does not sometimes comprehend how to do it. So, usually using these methods when it comes to behavioral and occupational combined aids the individual into hopefully being independent and not dependent.
Miriam, sometimes they put it in a small pamphlet.
Yes.
Where they pictures and they put it in the pocket, especially if the child is going to school for education, and so they will know what to do. And regarding school and education, the advice method of teaching is individual-based teaching, where each individual with autistic spectrum disorder have his or her own one-on-one teaching. Why? Because, as you said, it's a spectrum. Each one is different than the other. One will be responsive to visual cues. One of them will be responding to hearing or audible cues. Sometimes we might use music in order to teach them, because they are very smart regarding taking out the auditory signals. So there are many methods in teaching autistic spectrum disorder people, but it should be individualized. Each person is different.
Absolutely. Now, we said there isn't a full evident cure, but sometimes certain medications are given, and the medications are given depends on what's the coexisting condition.
Exactly.
So, for example, if a child has epilepsy, there are anticonvulsants given for this child with autism. Headaches or migraines, certain types of painkillers, sleep disturbances, certain medications, melatonin, or even stronger to aid in sleeping habits. So sometimes medication is given, but not necessarily to treat autism, but to treat the coexisting factors that come along with autism at times.
Exactly. Yeah. And also, Mariam, we shouldn't only focus on autistic people, also their families, their siblings. Teaching and behavioral therapy to parents how to manage a child with autism. Usually it's a shock for a parent when you give them the news that your child have autistic spectrum disorder, and they become depressed. They don't know how to deal with them, because, as we said, sometimes in the media, movies, series, all of them, sometimes they tend to exaggerate a little. And we always tell them that this is a spectrum. Your child not necessarily is on the severe spectrum, might be in the middle or even the mild one. So each one is different, and we teach the parents how to deal with them. We also bring the siblings how to deal with their brother or sister at home. When they are aggravated, when they are anxious, when they are scared, how to deal with them, what to do to avoid those attacks or tantrums. At school, the same thing. We should teach them in the school administration how to deal with such cases. It should be individualized, move away from the triggering factors of flashing lights, sounds. If you have another child who's having like tantrums or tics, then it's better to put them in another class, because those tend to shout or scream at sometimes, and it might trigger autistic person.
Absolutely. And let's not forget speech therapists. They have an important and vital role when it comes to nonverbal and sometimes verbal, just to express their feelings and how to communicate. Because there is a misconception that autistic children, they're not able to even produce any sounds. They can produce sounds. They can, their vocal cords are working and function. It's just they cannot communicate. So this is where a speech therapist comes in hand, in order to start to re-educate and communicate with these types of conditions as well. On the other hand as well, let's not forget that when it comes to also the household, keeping a safe environment for these types of the individuals and conditions, because as we mentioned earlier on the episode, that sometimes they can harm themselves. So at least having a safe environment, and obviously this comes back to behavioral therapy. Teaching a child a knife is harmful. You do not open a window and look outside, lean outside. In a car, crossing the street, all of these things you have to educate from A to Z. So having a safe environment at home and outside the household is very important when it comes to autistic behavior.
Not only that, Mariam, also taking a good care of the hygiene of the baby. Like not making the nails long so they don't scratch themselves or hurt themselves, put a dental guard so they don't bite themselves. So there are many things that you can do. And the good thing about what we have mentioned so far, many people, and especially with that child, when I asked about her, she showed some improvement in behavioral, and many people actually they become near normal and they mingle well in the society. They have their own jobs, they have their own friends, but the symptoms will be reduced a little. So I think it's not hopeless of having a child with autism. It just needs a little bit patience and a little bit of hard work in order, and early diagnosis in order to show a really good progress in adulthood.
Absolutely.
The only thing and the only point that I want to mention is that vaccination has nothing to do with autism.
This is the controversy, Sundus, in many countries, many social, economical status. It doesn't matter. So this is a misconception. But
and they actually revised that study, and they retracted the study because it was very weak and didn't have this good foundation that it causes autism. So not vaccinating the children has its own alarming and own problem, because it's gonna re-emerge all the diseases that we have eradicated or nearly eradicated over the years, and it will cause infection in the immunocompromised, and it's really a serious problem if an immunocompromised received an infection that causes with children regular rash and fever. With immunocompromised, it may lead to infection in the brain and the heart or even the eyes. So it's a serious complication, and I think it's worth discussing it with a pediatrician if you are thinking of not vaccinating your child, to give you all the cons and pros regarding the vaccination.
Yes, absolutely. And if it's genetic, obviously you cannot change your genes, because we said that it's highly due to genetic. Now, some environmental factors actually do tend to contribute. So if a child was born early, early labor or early birth weight, sometimes these things can contribute to it. But again, there is no definite cause when it comes to being diagnosed with autism.
Definitely. And Mariam, we said that early detection plays a good role in the progress of the management of the disease. So don't miss the follow-up with your pediatrician. Regular follow-ups at the age of 2 months, 6 months, 9 months, 1 year, 2 years. These are very important and very crucial, because at that time, we don't only examine the child physically, we also examine the child milestones, and we want to see, is the child developing normally according to the milestones or not. So if you continue follow up with your pediatrician, then definitely the early signs and the alarming signs will be picked up early, and the diagnosis will be made early, and thus the management will be early. I think we came to the end of our episode, unfortunately, and I hope our dear viewers, you got the benefits and the tips and points regarding autism. Hope to see you again in a new episode in our program In Sync. You have a good day.
See you next time.